CPR, Cardiopulmonary Resuscitation, is a life-saving technique which is used when someone's breathing has stopped. Initiate CPR using the mnemonic CAB, which stands for compressions, airway, and breathing. The CPR cycle is the same for adults and pediatric victims. When aiding someone, use the acronym FIRST AID, AID. When coming upon an unconscious victim, check for responsiveness by tapping them and asking if they are okay. If there is no response, call loudly for help and get the attention of bystanders. Check the victim's breathing. If they are not breathing or are not breathing normally, it is not enough air to sustain life. Start CPR. CAB, compressions, airway, and breathing. Start with C, 30 compressions, then A, open the airway, then B, give 2 rescue breaths. C, compressions. Our body position, hand placement, and timing are all important aspects of CPR. Kneel close to the side of the body. Place your hands in the middle of the chest on the lower half of the breastbone. Interlock your hands, keeping your fingers off the ribs. Position your shoulders directly over your wrist with the elbows locked. Perform 30 compressions. Push hard, push fast. Aggressively maintain compression depth of 2 inches, not exceeding 2.4 inches in depth. Maintain a compression rate of 100 to 120 compressions per minute. Completely release pressure with each compression for maximum blood flow. Minimize any interruptions to chest compressions. If possible, change the compression person when fatigued. Proceed to A, airway. Open the airway. Tilt the head back using the head tilt chin lift maneuver. Place the heel of your palm on the victim's forehead and your fingertips under the bony point of the chin, tilting the head back. Then proceed to B, breaths. Give 2 rescue breaths. Pinch the soft part of the victim's nose closed using the index finger and thumb of the hand that is on their forehead. Take a normal breath and place your lips around their mouth, making a good seal. Blow steadily into the mouth while watching for the chest to rise. This should take no more than 1 second. Take another normal breath and blow into the victim's mouth once more to give a total of 2 effective rescue breaths. If the initial rescue breath does not make the chest rise, then recheck that there is an adequate head tilt and chin lift. Do not attempt more than 2 breaths. Return to chest compressions if the breaths are unsuccessful. If for any reason the rescuer is unable to perform rescue breathing, compression-only CPR can be utilized. However, according to the American Heart Association, at some time during prolonged CPR, supplementary oxygen with assisted ventilation is necessary. One of the goals of CPR are to restore the energy state of the heart. Adequate oxygen is necessary to achieve these goals. It is important to maximize the oxygen content of the arterial blood.